My name is Dusty Davis. I'm the Executive Director at the Villas.
And I'm Stephen Brewer. I am the Executive Director of Nursing at the Villas.
The Villas is a licensed skilled nursing facility. We do mainly short-term rehab. We get people in and we get them therapy and we get them home as soon as we can. That's our main focus. So we saw an opportunity several months ago where we worked with the Queens Health System. We had specific meetings with the administration of Queens where we made a decision that we were going to work to get a pathway for those people who have had strokes. A stroke is a devastating occurrence. When that happens, you're so devastated and it's very confusing. And so we wanted to make a pathway that was smooth for the families so they would know where they were going, what was going to happen, and how it was going to happen. We worked with Queens and we came up with a program where when we admit a Queens patient, we have specific order sets. We have a specific way that we treat those people. We do our best at times. If it's best for the residents, we send them to Rehab of the Pacific to get additional therapy maybe, or maybe they just stay here and we walk them through that pathway. We do try to get them home as soon as possible, but it's kind of a long journey. And so we've worked really hard with Queens, the Queens system, the Queens physician, and of course our staff, our therapy staff, our licensed staff, to do additional training, to do additional preparation so that we're ready for those cases, and hopefully it's a smooth transition for all of them.
What we're really trying to do here at the Villas is to kind of complete the spectrum of care. For a lot of patients, that begins in the hospital, that continues at the Villas with short-term rehab, and then from there a lot of patients are going to go return to home. But for most people, they're not fully back to all their activities yet and the things they used to do before their injury or their illness. So here we're trying to build that network of care to have a comprehensive program where people can get all of the different needs met. It's a team effort, making sure that the patients have everything they need to maximize their function. And then from there, the therapists will work with people to get stronger, to set goals for them with different types of function, trying to really help people get all the way back to doing all the things they used to do. The thing that goes really well here is the coordination of care between the different health professionals. Here, I've seen a really good communication between the nurses, the therapists, the doctors. It's really trying to get a good schedule of care and activities throughout the day so that people are not just doing things here and there in isolation, but coordinating the different types of care that occur so people can really thrive and do well.